Hello and welcome to Surgery Pack Wrapping 101. I don't know what's in here. Probably some instruments. So we have the indicator strip that tells us that it's sterile. Our gauze and our instruments. So if you wanted to lay the instruments out for the vet, you would do it like so. I want to have the ring handles close to the surgeon. And the instruments that she's going to use, the instruments that we don't think that she's going to use, and still keep them over on this side here, just in case she needs to use them. So I'll go over what I'm getting out. And typically these packs are for spays and neuters. That's the most common surgery. So I always have them in order of how she's going to use them closer to her. She doesn't use the scalpel handle, so I set that aside. If it's a neuter, I will set this aside. That is the spay hook, or a snook hook. So let's say it's a spay. I'll put it over there for the doctor to use. Depending on the size of the patient, if it's a larger patient, she's going to use larger clamps, like these Carmalts. See the Carmalts? The light's real terrible. Let me turn the light on. Hold on 1 second. See if this helps. Okay. Yeah, I really think that helped. So that's a Carmalt. You can see the lines are going along the instrument, not going the other way like this Kelly forcep. And I'll go over instruments in detail later because it's kind of hard to get the focus on this, but this is how to set up a pack, and then more importantly we'll show you how to wrap it. But the first thing that she's going to do is make an incision with a scalpel blade. So you can open it like so, set it on the towel, just drop it. Then you can take the scalpel blade, put it on a square of gauze and set it there so it's easy to see. There's good contrast there. She's going to use the scalpel blade, and then she's going to use the Brown Adson forceps. Those are the Brown Adson forceps. I have the phone hooked up to an oven hood, so it's kind of hard to get that to focus. I could tap on it, but then it'd start knocking around like that. So she used the Brown Adson forceps, needle holders or needle drivers, Metzenbaum scissor. You can see our old method of using instrument tape. The instrument tape that they have now is terrible. You can see that this is sliding around and coming off. So we have silicone tape that we're going to be using instead. So that's our Metzenbaum scissor. That's our Mayo scissor. Carmalt. Mosquito hemostat. So Halstead. It's an Alice tissue clamp. ALLIS. So I don't get this out for a spay and neuter. She's most likely not going to use that, but if she runs into a problem, she's going to have the instruments over here that she can grab. So just kind of have it somewhat organized, just over here. Towel clamps, she's going to use at least 2 of them for one either side of the fenestrated drape that she uses. There's a variety of other thumb forceps here she doesn't normally use. We're going to be consolidating these packs and making all these packs the same eventually, real soon. So I'll put all that to the side, and these are the instruments that she's going to be using. The surgeon's here. She's going to be grabbing with the ring handles here. So obviously here's your gauze, and I will have probably a good stack of gauze ready. And then there's the other stack I'll put to the side. We used to count the gauze as 30 gauze each. That's a great plan to count all the gauze squares. However, there has never been a surgery that we've counted the gauze squares afterwards. So I didn't really see the point in that. We can have a laparotomy pack that we have gauze that's counted, but we'll go over that in a later video. So anyways, this is the important part here on how to wrap the pack. So be a big help on Sundays to have these packs wrapped if you have time, so we can focus on getting the patients processed on Monday morning instead of having to wrap the packs. That'd be a huge help. So we'll get everything. This is how everything's gonna look. Everything's gonna be everywhere. So the first thing that you do, just set something here. First thing you're gonna do is grab one of these Huck towels. H-U-C-K, Huck towel. Make sure there's no holes. Make sure there's no hair. If you see hair, get a pet hair roller. Roll that off on both sides. But you want to get a nice big Huck towel with no holes. So this is the order in which you're going to do it. First thing is going to be the needle holder. Second is going to be your scissors. Metzenbaum, Mayo. Then after your scissors, now keep in mind this is not going to be the exact thing that's going to be in every pack, because we're changing the packs and making them a lot more predictable. Then you're going to have the Carmolts, which are the larger clamps. And then you're going to have the smaller hemostats. Oops, missed the Alice. Now the Alice tissue clamp, when we do this, it's okay if you have the Alice tissue clamp here or here between the scissors and the Carmolts. Because what happens is when we get everything together and everything's set up in the pack like this, we're gonna kind of take it apart and organize it for the surgeon anyways. Right? So as long as it's organized when we pull apart the pack and get ready. So I'm going to take the needle holder, put it in the palm of my hand, take the Metzenbaum, the Mayo, there's another curved Mayo scissor, the Alice tissue clamp, and again that can be on either side of the Carmolts. So you can do the Carmolts first if you want. You can see how the curve is going towards the left. The instruments that you have, in the smaller instruments you can put, see how this one fits better smaller to the left. And then we'll take our Alice tissue clamp and put it there. Now we'll start working with our hemostats. You're going to start with the straight hemostat first, and then do the curved hemostats next. This isn't a hard and fast rule for every animal hospital. Every animal hospital does it a little different. I'm going to take the thumb forceps, place them together along with the blade holder. There will be relief veterinarians that use the packs that we want to have that blade holder in there. So it doesn't need to be absolutely perfect as long as they're grouped together. And there should be 4 towel clamps. This pack had 5 here, so 4. So I have everything laid out like that. So you're going to take your spay hook and put it through the ring handle of all of them. You can kind of catch it on the end of the needle holder, and then you can lay that down and kind of snug it up. Then take your gauze. If you want to count 30 gauze, that's great. Make sure to label it that there's 30 gauze when you label the autoclave tape. You can put the gauze right up against the instruments to the left like that. Because remember, we're going to be moving the gauze when we mess with our instruments to get them ready. There are people that have just set the gauze on top like that. That's fine. And you get your sterile strip, you have it right at the top. So when we open the pack, we know that it's sterile. It's going to look like this when it is steam autoclaved. So then you're going to take your huck towel and fold it over on the bottom and then the top, and then fold one side over and then the other side over. Not too tight so that the steam can't penetrate, but not too loose to where the instruments are rattling around. And then you're going to get a large surgery wrapper like this. And then you're going to lay it over. Nice and snug here. Not too loose. And then pull this back to where there's a little tongue here. That's your first step. Second, take the other side, wrap it nice and snug there. And then you're going to do what's called accordion, to where you're going to go back like this, and it's covering that pack where that pack is. And then accordion. Out like that. So when we're opening the pack, we're pulling furthest away from the sterile field. Sterile field, the middle of it's there. Do the other side. Accordion back. And then make sure to always have it out. So then you're going to take the end And you're gonna go over. So now there's an area where those two folds are over, and you're gonna tuck that large tongue in both of them. Then you're gonna leave that sticking out like that. Then you're gonna take the autoclave tape that when the autoclave tape is sterile after being put through the autoclave, there's going to be these black stripes on it. When it's not sterilized, the black stripes will not show up, but you can faintly see them if you look closely. So a sterile pack, at least from when the outside is exposed to steam, it's going to look like that. It's going to have the black lines on it. So you're going to take the autoclave tape, do a tab here. You're going to put it across here. Half of this is on the top, spanning here, and the other half should go on the bottom. If you only have it so there's a little bit like this, the pack will open in the sterilizer. You're going to put what it is, whatever color it is. You're going to put the date, month, date, year, and then you're going to put your initials after it. So if there's any problems, you know who did that. Now you know that it hasn't been exposed to steam because there's no black lines there. Then when you open the pack, let's say it's been sterilized, it's going to be easy to open. Ready to roll. Stay safe out there.